one of the things that people may not yet know, we've tried to share this with our implementation teams, is a fantastic opportunity that has been given to us by the Jessie Ball duPont grant fund. And we are very grateful for this, because this is going to allow us to continue to work in the Northern Neck as well as the Middle Peninsula. And what it means is that we'll be able to continue to provide some form of support for the resilience committees that are being established, or if a community has not yet established one and would like assistance in doing that, we would be available to support that. It also means that we'll be able to provide facilitation support and work with John and the PDC closely in the development of the regional hazard mitigation plan. And then very importantly, what will be happening next year is something we're very excited about, which is we'll be forming a regional social equity work group. And I think this is really getting at one of the things that Chad mentioned earlier in the chat. And I'm trying to find his comment, but let me just see here. But he's from the Haven and talking about the need to really broaden the base of representation and engagement to those organizations that are working closely with the most vulnerable of populations in the Northern Neck. And so we will be forming this regional social equity work group that will be, because so many of the agencies and organizations that serve these populations do so across both the Northern Neck and the Middle Peninsula. This work group will be regional to be addressing both of those. And one of the roles that this work group will have is to help provide guidance to us on mini grants that we are going to be able to grant thanks to the Jessie Ball duPont Fund for boots on the ground types of projects that will increase resilience for historically excluded and underserved populations. Now, one of the things that I think sort of helps tie this all together are comments early on in this workshop by one of our communities about the importance of a holistic approach to resilience and the whole of community approach, as well as the work that was done by the COVID Rapid Response Team, Sierra and Ann Nelson Stoner, and finding that there are many opportunities and priorities that emerged because of COVID that we now know are areas of resilience that we need to build. And so I think what we'll be doing is looking at some of the findings from that report and investigation, as well as bringing people into this social equity work group to inform us on what are these needs. Where can, I think it was maybe Mason who said earlier, or somebody said, what are some of the easy wins that we can do, but we want them to be also meaningful, and that they will start a trajectory of resilience, and that we're providing support to these organizations that are working directly with the vulnerable populations. So that we're very excited about that. Is there anything else that anybody on the team wants to add about this as we move forward, things that I haven't mentioned? I do see a comment from Mark Walker, who is here with the Jessie Ball duPont Fund. And I think this is absolutely part of what will be happening, and that people can participate and will be compensated for their time. If they are not being paid by their organization to participate, or their organization doesn't have funding for this kind of participation. So thanks to the Jessie Ball duPont Fund, we will be able to compensate people for their participation. So think about, is this something that you could contribute to, you'd be interested in doing? We would want to know. Yeah, Elizabeth, I think you were trying to say something.
I just wanted to add that as you look at these two slides, you can see that the Jessie Ball DuPont Fund is really making a difference in this community at large, this region, for our vulnerable populations. And I think that's one lesson that is really being learned at the state level in Virginia too, that we're trying to incorporate into our master planning process, the taking into account the input and the needs of our historically underserved populations. So that it's exciting to be able to continue the work here that we started in the Northern Neck. So thank you to them. Karen noted that the Middle Peninsula Northern Neck Community Services Board has a behavioral health equity grant. Karen, did you want to elaborate on that?
The Department of Behavioral Health and Developmental Services granted us a small mini grant, really to gather barriers, challenges in the of serving Spanish-speaking individuals, and that can be immigrant, migrant, and farm workers, that can be families here, that can be anyone. Just to see where are the gaps in resources and services, what are the challenges with service providers, and really to inform a comprehensive report of next steps to really build workforce capacity to serve Spanish-speaking individuals, as well as engage this community. As I know, speaking just for the Community Services Board, we lack Spanish-speaking providers, and so really being able to provide education to our HR departments and others about the need for workforce development. So if anybody has connections to the Spanish-speaking populations in our 4 counties in the Northern Neck. Sorry, the Northern Neck serves all 10 of the Middle Peninsula and Northern Neck. So if anyone's interested, just get in contact with me. Thanks.
I did see John had his hand up.
I was just gonna give a shout out to Bay Aging, who also is doing a lot of work in that space, especially in the aftermath of COVID. I know Josh Jamerick was on here earlier. And Pat Farrell also represents Bay Aging, but they do a lot in this space as well in creating equity in services.